example of the support provided by our alumni friends. On on the behalf of our college, I express my sincere gratitude and deep appreciation to all our esteemed alumni friends. Let us start today's program by seeking grace from God Almighty. I request all of you to kindly be silent for a few seconds for the silent prayer. Thank you for all dear friends. I invite Rincy Thomas, Assistant Professor, Department of Physics, CMS College, for welcome speech.
Hello everyone and welcome to today's session. Heartily welcome to all the participants for the webinar on application of nanomaterials for theranostics, organized by the Department of Physics, CMS College, Kottayam, with our prestigious alumni as resource person. Today we have Dr. D. Sakthi Kumar with us. He is an eminent scholar and director of Bio-Nano Research Center, Toyo University, Japan. On behalf of Department of Physics, we welcome you, sir. Also, we sincerely welcome Dr. Santosh Potare, Head of the Department, BPC College, Perava, and the President of our Alumni Association for this webinar. And I also welcome our beloved teachers, Dr. Rajan K. John, Matthew C. Matthew sir, colleagues, students, and all the participants here. Even though our HOD, Dr. Renu Jacob, is the backbone of this webinar series and all the activities of the department, I welcome her wholeheartedly to our midst. On behalf of the Department of Physics, all the teachers and participants here, once again, welcome you, Dr. D. Sakthi Kumar. Thank you.
Thank you, Rincy teacher. The President of our Alumni Association, Dr. Santosha, HOD, BPC College, Piravam, is also with us. He also serves as the Secretary of APT, Academy of Physics Teachers in Kerala. I invite Santosh sir to say a few words of felicitation.
Thank you for your nice words. എല്ലാവർക്കും നമസ്കാരം. ബഹുമാനനായ പ്രിൻസിപ്പൽ ഇൻ ഹിസ് ആബ്സെൻഷ്യ, എൻ്റെ ഏറ്റവും പ്രിയങ്കരായ അധ്യാപകർ, ഡിപ്പാർട്ട്മെന്റ് ഹെഡ് റീനു ജേക്കബ്, അലുമിനി അസോസിയേഷൻ്റെ ബഹുമാനനായ സെക്രട്ടറി ബ്ലസൻ ജോർജ്, Academy of Physics Teachers-ന്റെ ജോയിന്റ് സെക്രട്ടറി ഡോക്ടർ സീമ, എക്സിക്യൂട്ടീവ് മെമ്പർ ഡോക്ടർ പ്രീമ, മറ്റ് സമാരാധ്യരായ അധ്യാപകരെ, ഏറ്റവും പ്രിയപ്പെട്ട എൻ്റെ സീനിയർ ഫ്രണ്ട്സ് ഡോക്ടർ ജെയിംസ്, ഇന്നത്തെ നമ്മുടെ വിശിഷ്ട അതിഥി ഡോക്ടർ ശക്തി, ഈ സെമിനാറിൻ്റെ റിസോഴ്സ് പേഴ്സൺ ഡോക്ടർ ഹരി, മറ്റ് സ്നേഹിതരെ, എൻ്റെ ക്ലാസ്മേറ്റ്സ് പലരും ജോയിൻ ചെയ്യുമായിരിക്കും. സുനിലുണ്ട്, അതുപോലെ എൻ്റെ ടീച്ചേഴ്സ് മാത്യു സി മാത്യു സാർ, രാജൻ സാർ, രാജഗോപാൽ സാർ, വേറെ ആരൊക്കെ ഉണ്ടെന്ന് എനിക്ക് അത്ര അറിയില്ല. എല്ലാ ഗുരുക്കന്മാരുടെയും പാദത്തിൽ ആദ്യമേ ഞാൻ പ്രണമിക്കട്ടെ. ഈ എൻ്റെ ഒരു ചെറിയ പ്രസംഗം എനിക്ക് 2 മിനിറ്റാണ് തന്നത്. ഞാനത് അപേക്ഷിച്ച് 5 മിനിറ്റ് ആക്കിയിട്ടുണ്ട്. അത്ര സമയത്തേക്ക് ഇതിൻ്റെ ഒരു ഔപചാരികത അല്പം ഒന്ന് മാറ്റിവെക്കുമായിരിക്കും. കാരണം മസ്തിഷ്കം സംസാരിക്കുന്നതിനേക്കാൾ ഹൃദയം സംസാരിക്കുമ്പോൾ ഔപചാരികതകൾ ചിലപ്പോൾ മറന്നുപോകും. എൻ്റെ CMSന്റെ കാലം അതിലേക്ക് പോകുമ്പോൾ എപ്പോഴും മാതൃവിദ്യാലയത്തിലേക്കുള്ള ഒരു മടക്കം അത് വളരെ ഹൃദ്യമാണ്. എപ്പോഴും ഗൃഹാതുരത്വത്തിൻ്റെ ഒത്തിരി ഓർമ്മകൾ നമ്മുടെ മനസ്സിലേക്ക് വരുമ്പോൾ ഔപചാരികത അല്പസമയത്തേക്കൊന്ന് മാറി നിൽക്കും. ക്യാമ്പസിലെ ഞങ്ങൾ വരുമ്പോൾ, ഞങ്ങൾ ഡിഗ്രി കഴിഞ്ഞ് PGക്കും അവിടെ തന്നെയാണ്. അപ്പോൾ ഷീനയൊക്കെ ഉണ്ട് അവിടെ. അന്ന് സീനിയർ ടു സീനിയർ ആയിട്ട് എൻ്റെ കൂടെ ഉണ്ടായിരുന്ന റോജൻ എബ്രഹാമിന്റെ ചേട്ടൻ റോഷൻ എബ്രഹാമിലൂടെ ശക്തിയുടെയൊക്കെ ബാച്ചിലെ എല്ലാവരുമായിട്ട് വലിയ സ്നേഹമായിരുന്നു. അന്നത്തെ കാലം നമ്മൾ ഓർത്തെടുക്കുമ്പോൾ MSCക്കൊക്കെ ഞങ്ങൾ വരുമ്പോൾ ചെറിയ റാഗിങ് ഒക്കെ ഉണ്ടായിരുന്നു. അതൊക്കെ ഞാനിങ്ങനെ ഓർക്കുകയാണ്. അപ്പം സാർമാരെ ഇതൊക്കെ അറിയുന്നുണ്ടെങ്കിലും മാത്യു സാറൊക്കെ അറിയാത്ത പോലെ നടക്കുമായിരുന്നു. പക്ഷെ അതൊരു വലിയ കരുതലായിരുന്നു. അന്നത്തെ വലിയ സൗഹാർദ്ദവും വലിയ കരുതലും പിന്നീട് നമ്മൾ അനുഭവിച്ചിട്ടുണ്ട്. അപ്പൊ അവര് അന്നത്തെ ഫിസിക്സ് ക്യാമ്പസിന്റെ സൗമ്യവും സജീവവുമായ സാന്നിധ്യമായിരുന്നു. സത്യം പറഞ്ഞാൽ ശക്തിക്ക് യഥാർത്ഥ ശക്തി കൈവരുന്നത് ഉമ്മനും മോനും ഒക്കെ ചേരുമ്പോഴാണ്. അങ്ങനെ ഒരു മൂവർ സംഘം ഞങ്ങൾക്ക് വലിയ ആരാധനയോടുകൂടി നോക്കിക്കണ്ടിരുന്ന കുറച്ച് പേരായിരുന്നു. അവരിലൂടെയാണ് അതിലും വലിയ ആരാധകനായ ഒരു മനുഷ്യനുണ്ടായത്. മറ്റാരുമല്ല, ഇന്നലത്തെ നമ്മുടെ പ്രഗത്ഭനായ പ്രസംഗകൻ ഡോക്ടർ ജെയിംസ്. ഞാൻ ഔപചാരികത മാറ്റിവെച്ചത് അതുകൊണ്ടാണ്. പണ്ഡിതൻ എന്നാണ് അദ്ദേഹം അറിയപ്പെട്ടിരുന്നത്. അദ്ദേഹത്തെ ആരും അങ്ങനെ വിളിച്ചിട്ടില്ല. അങ്ങനെയാണ് അദ്ദേഹം അവിടെ അറിയപ്പെടുന്നത്. ഒരു ദിവസം രാജൻ സാർ ക്ലാസ്സിൽ വന്നിട്ട് പറഞ്ഞു, ജെയിംസ് റീഡ്സ് 48 hours a day. ഈ ഒരു കമന്റ് ഇപ്പോഴും ഇങ്ങനെ ഓർമ്മയിൽ നിൽക്കുകയാണ്. പിന്നീട് വലിയൊരു വിസ്മയകരമായ സംഭവം ക്യാമ്പസിൽ ഉണ്ടായത് എന്താന്ന് ചോദിച്ചാൽ, എനിക്ക് JRF കിട്ടി എന്നുള്ളതാണ്. അതെങ്ങനെ കിട്ടിയെന്ന് ഇപ്പോഴും ആർക്കും അറിയില്ല. അതാണ് അതിന്റെ വാസ്തവം. അപ്പോ പിന്നീട് എനിക്ക് എൻ്റെ സുഹൃത്ത് ജെബി അന്ന് IIT-യിലുണ്ട്, ജെയിംസിന്റെ കൂടെ. ഇവരാണ് IISc-യുടെയും IIT-യുടെയും ഒക്കെ വാതിലുകൾ എനിക്ക് വേണ്ടി തുറന്നു തന്നത്. ആ സൗഹൃദം അങ്ങനെ വളരെ പുഷ്പിച്ച് ഇപ്പോഴും വളരെ ഹരിതത്തോടുകൂടി നിലനിൽക്കുകയാണ്. അപ്പൊ ഞാൻ പറഞ്ഞു വന്നത്, ഞാൻ ഈ വൈക്കത്ത് നിന്നാണ്. അപ്പൊ ഇവിടെ ഈ കയറ് വിരിക്കുന്നവർ നമ്മളോട് പറയാറുണ്ട്, ഈ മുപ്പിരി കയർ ഭയങ്കര സ്ട്രോങ് ആണ്. അപ്പൊ ആ ഓർമ്മയാണ് എനിക്ക് ഉമ്മച്ചനെയും മോനെയും ശക്തിയൊക്കെ ഓർക്കുമ്പോൾ വരാറുള്ളത്. റോബർട്ട് ഫ്രോസ്റ്റ് പറയുന്ന പോലെ, 2 roads diverged in the yellow wood and I took the one less traveled. നമുക്ക് എല്ലാവർക്കും അറിയാവുന്ന രാജൻ സാർ പറഞ്ഞപ്പോൾ ക്വാണ്ടം മെക്കാനിക്സ് വെച്ച് പറയുമ്പം, ഞാൻ ഒരാളും 2 വഴിയേ ഉള്ളപ്പം രണ്ടിലും വരാനുള്ള ചെറിയ പ്രോബബിലിറ്റി ഒക്കെ ചിലപ്പോൾ വർക്കൗട്ട് ചെയ്യുമായിരിക്കും. പക്ഷേ ഞാനൊരു ഇലക്ട്രോൺ ഒന്നും അല്ലാത്തതുകൊണ്ട് വി ഹാവ് ടു ചൂസ് എനിവേ വൺ ഓഫ് ദം. ഇവരെ സംബന്ധിച്ച് എനിക്ക് എപ്പോഴും തോന്നിയിട്ടുള്ളത്, ദേ ഹാവ് ടേക്കൺ ദ റോഡ് ലെസ് ട്രാവൽഡ് ബൈ, ആൻഡ് ദാറ്റ് മേഡ് ഓൾ ദ ഡിഫറൻസ്. എ ബിഗ് ഡിഫറൻസ്. അങ്ങനെ ശാസ്ത്രലോകത്ത് അറിയപ്പെടുന്നവരായി CMSന്റെ ഫിസിക്സ് ക്യാമ്പസിനെ സംബന്ധിച്ച് മുത്തുകളായിട്ട് ഇവരിങ്ങനെ നിലനിൽക്കുകയാണ്. അത് വലിയ സന്തോഷം നൽകുന്ന ഒന്നാണ്. ജെയിംസ് ആരോ പറഞ്ഞതുപോലെ, ഈ ഫ്രണ്ട്സ് ആർ യുവർ വീക്ക്നെസ്, യു ആർ ദ സ്ട്രോങ്സ്റ്റ്. ഇതൊക്കെയാണ് നമുക്ക് ഇതിലൂടെ കാണാൻ പറ്റുന്നത്. ഈ ഇന്നത്തെ ഈ സ്നേഹ കൂട്ടായ്മയിലേക്ക് ഇത് വലിയൊരു ഔപചാരികതയൊന്നും ഇതിന് നൽകേണ്ടതില്ലെന്ന് എനിക്ക് തോന്നുന്നു. കാരണം ഇതൊരു കുടുംബ സംഗമം പോലെ ഹൃദ്യമാണ്. എൻ്റെ സുഹൃത്ത് ഷിബു ജോയിൻ ചെയ്തിട്ടുണ്ട്, പ്രിൻസിപ്പൽ CMS സ്കൂൾ. വലിയ സന്തോഷമുണ്ട്. ഒത്തിരി പേരെ കണ്ടു. രാജൻ സാറിനെ ഇതുവരെ കണ്ടില്ല. എൻ്റെ സ്ക്രീനിന്റെ പ്രശ്നമാണോ എന്ന് എനിക്കറിയില്ല. രാജഗോപാൽ സാറിനെ കണ്ടു. ആ ഒരു ഹൃദ്യതയിലായിരിക്കുക എന്നത്, ഞാൻ ഈ പിള്ളേർക്ക് ഒരു മെസ്സേജ് അയച്ചു. എൻ്റെ ക്ലാസ് ഞാൻ ഇത് തീരുന്നവരെ മാറ്റിവെക്കാം എന്ന് പറഞ്ഞിട്ടുണ്ട്. കുട്ടികൾ കേൾക്കുമെന്ന് എനിക്ക് തോന്നുന്നു. എനിക്ക് ഇടയ്ക്ക് അവർ വിളിച്ചില്ലെങ്കിൽ ഞാൻ കഴിയുന്നവരെ ഉണ്ടാവും എന്ന് തോന്നുന്നു. അലുമിനി അസോസിയേഷനെ സംബന്ധിച്ച് പറയുമ്പോൾ ഒരു അഡോക് പൊസിഷനിൽ ഞാനിപ്പോൾ ഇരിക്കുന്നു എന്നുള്ളതേ ഉള്ളൂ. അത് ഞാൻ റീനുവിനോട് നേരത്തെ തന്നെ പറഞ്ഞിട്ടുണ്ട്. നമുക്ക് പ്രഗത്ഭരായ അലുമിനി ധാരാളമുണ്ട്. അവരെല്ലാം ചേർത്തുകൊണ്ട് വളരെ വളരെ ക്രിയേറ്റീവ് ആയിട്ടുള്ള, ഇനി വരാനിരിക്കുന്ന ഫിസിക്സിന്റെ വാഗ്ദാനങ്ങളായിട്ടുള്ള CMSലെ കുട്ടികൾക്ക് ധാരാളം കരുതൽ കൊടുക്കുവാനുള്ള വലിയ സാധ്യത ഞാൻ കാണുന്നുണ്ട്. ഓൾവേസ് CMS ഈസ് ലീഡിങ് ദ അക്കാഡമിയ ഇൻ മെനി വേസ്. We have seen in papers, every day it is in limelight. They are providing new technologies, new methods for online teaching. Glass boards are installed and things like that. We are hearing every day about CMS College. And we are really happy about when we read about CMS College. ആ ഒരു വലിയ പാരമ്പര്യത്തിന്റെ ഭാഗമാകുക എന്ന് പറയുന്നത് വലിയ സന്തോഷമാണ്. അവിടുത്തെ എല്ലാ അധ്യാപകരെയും ആത്മാർത്ഥമായിട്ട് ഞാൻ അഭിനന്ദിക്കുകയാണ്. As far as Academy of Physics Teachers is concerned, now I am the former secretary. Yesterday I have shifted my position. The CMS was Department of Physics. CMS was have played a pivotal role in the activities of the academy. Last year we had a workshop on XPICE at CMS. Dr. Sam was the coordinator, and Dr. Prima is there in the executive committee. She is playing a beautiful role there. And every one of the faculty we are happy to associate with. And today I'm really happy, and I thank Dr. Reenu and her team coming forward with such a relevant topic and seminar. Sakthi ജാപ്പനീസിലൊന്നും അല്ലാതെ ഞങ്ങൾക്ക് മനസ്സിലാവുന്ന ഭാഷയിൽ ഇതൊക്കെ പറഞ്ഞു തരുമെന്നാണ് എൻ്റെ പ്രതീക്ഷ. ഞാൻ ഏതായാലും അത് കേട്ട് മനസ്സിലാക്കാമെന്ന് വിചാരിച്ചിരിക്കുകയാണ്. എൻ്റെ ബാച്ച്മേറ്റ്സിന് ഞാൻ ഇന്ന് രാവിലെയാണ് ആ മെസ്സേജ് ഇട്ടത്. എത്ര പേര് കണ്ടു കാണുമെന്ന് അറിയില്ല. കണ്ടാൽ തീർച്ചയായിട്ടും എല്ലാവരും വരും. നാളത്തെ നമ്മുടെ റിസോഴ്സ് പേഴ്സൺ ഹരി സാറിനോടും എൻ്റെ എല്ലാ ആശംസകളും അറിയിക്കുന്നു. ആൻഡ് ഐ റിയലി താങ്ക് Dr. Reenu and her team for inviting me for this and giving me a chance and for giving me memorable moments. Thank you very much. Over to Dr. Reenu.
Thank you, sir, for sharing your nice words and also for sharing your experience with CMS College. Now we are moving to our today's talk. Before that, I have a few announcements to participants. As yesterday, the participants can pose their question in chat box. The questions will be answered at the end of the session. A feedback form will also be shared in the chat box. Those who want the certificates at the end of the 3-day program, they have to fill the feedback form. Now let me introduce the resource person, Dr. Sakthi sir. The resource person for today's program is Professor Sakthi Kumar, Director, Bio-Nano Electronic Research Center, University. And also, the topic is application of nanomaterials for aeronautics. Professor Sakthi Kumar, one of the well-wisher of the department. We, the faculty members of the department, are deeply indebted to Sakthi sir for playing a vital role to sign an MOU with CMS College and Bio Nano Electronics Research Center, Toyo University. The research topics of Sakthi sir has a wide spectrum. Let me share a few of them, which includes nano drug delivery against cancer and other disease cells, development of biomaterials, nanomaterials and devices, artificial intelligence in biofields, plant nanotechnology, organ on a chip, carbon nanotubes, and quantum dots for bioimaging and solar applications. Sir has lots of papers and awards and awards and honors in his credit. A few of them are, sir has a high citation index of 633. Sir holds an X index of 35 and I-10 index of 80. Sir was the invited panelist of the subject expert for the proposal of policy making decision discussion organized by Government of India for the period for the year 2006, 2017, 2016, 2017, 2018, and 2019. Sir is also the coordinator of the collaboration of BNERC from 2014 onwards. Sir is the editorial member of scientific reports in Nature Publishing Venture. Sir has edited 3 books and 14 book chapters. He has more than 8 patents and 145 articles. Indeed, I am so honored to invite our esteemed speaker, Professor Sakthi Kumar sir, to lead today's session.
Okay. Can you hear me?
Yes, sir.
Is okay?
It's okay.
Okay. First of all, thank you very much for inviting me, Dr. Reno, for this webinar series. As Santosh already mentioned, I feel that it is not a seminar or something like that. It is our family gathering. So in a family gathering, we are sharing some of our thought patterns or whatever the things which we have done. That's all. So naturally, whenever we are going for a seminar, giving a talk or something, always when we have a very big gathering, before starting around 3 to 5 minutes, little bit, even, little bit shivering will be there before giving, whether it will be okay or something like that. But, as Santosh already cleared all those things, now I am not in a mood even to give a presentation kind of things. Almost everything has gone from my mind and already gone into our CMS college days. So anyway, thank you for that one, Santosh. Normally, always it will have a difficulty in starting as one of our earlier colleagues, Professor Kroto, who got the Nobel Prize. He always says, always 2 to 3 minutes, even he is having a little bit rambling before starting the talk. So then I thought, okay, it's okay for me also. So first of all, I would like to thank all of my teachers. Because of them, I am here, and only because of their blessings, I have reached here. Always I am indebted to them. And also my friends, as you have mentioned, Women Mohan, that is actually, you have told, we 3 always have there, always together. And without we 3, it's very difficult to see others in our campus. And also our friends. I have got a lot of friends. Sunil is there, and almost Shibu, everyone is there. So I am must be thankful to you all through my journey. You have supported me for all my goods and bad times and all the things. And as you have mentioned, Santosh, it is indeed very happy to meet James Raj sir. When we were studying, we heard about him always, as from Rajan sir, and everyone is always talking about James Raj sir, and that is actually our inspiration, to be frank. So I am happy that, our inspiration is also among us. So even though we had seen at that time, we have heard, okay, James Raj sir is there, and he has set some standard. Then, we had to reach there. Then we heard about our Rajagopal sir. He went to Karyavatam and that kind of things. So slowly, it came to our mind. We also have to go for some research and that kind of things. So it came, and we have reached now in Bio Nano Center. So thanks for everyone for joining, and I would like to give some presentation on, not as a big presentation which I am planning, because we are working in the field of bio nano science, and most of this one is coupling of biotechnology and nanotechnology is not that much popular everywhere. So, but I wanted to introduce what you can do with this nanotechnology in bioscience, and it's a fascinating field. So when you are coming into that field, you can see a lot of when you are going from the top to down, that is called nanotechnology. When you go down, after reaching some time, many persons ask why you are coming from physics, and how can you do these kind of things. But once you reach at some level, you can see that almost all subjects are coming together. So that is why, even in earlier we were saying that, philosophy, the doctor of philosophy, still we are having this philosophy. Philosophy is, and many subjects came up from there. So, but when you see that one, physics, chemistry, maths, and everything, and biology, while we are going down in the nano level, we can see that everything is merging together. At that time, we cannot see any difference, whether this is physics or chemistry or biology or something like that. Or for all these things, we need some mathematical interpretation too. So my interest is to show that, how this one is interacting each other and getting some good results for the better life for us. And for that, actually, I would like to present my presentation based on theranostics. Theranostics means therapy and diagnosis. So we can say two ways, theragnostics or theranostics, both are same, no problem. So what we are doing, therapy, we have to do after diagnosis. So normally we are doing diagnosis and then we go for therapy. But in this case, with one shot, we are doing both. That is the theme of this one. So why this one is important, that I would like to give my presentation. I would like to share. Hope I think this one is can be seen. Okay. So this one is application of nanomaterials for theranostics, and you can see here very beautiful scenery. Okay, we can enjoy these things. So then you can see this one also. Within I think 1 month to 1.5 months, Japan is going to be like this. It's very beautiful everywhere, and of course these kind of things. So, but one thing is there, and to enjoy this kind of things, our body should be in a good condition, because if we cannot enjoy, if we cannot have our body in a good condition, that means we don't have a swasthya. Means in Sanskrit we may say that in a good style, or and asti means to live or exist like that. So if it is not there, whatever things is coming in our front, we will not be able to enjoy. That's the main problem. So for that, in our literature, in earlier literature also, we say that arogyam, that is the best thing which you have. So other things will follow everything. So, but even if you have a little bit a problem in health or something, if you know that it can be cured, then it's okay. Then we will come into terms with other things, and after that, we will start enjoying our life. But when we think about cancer, this is actually creating a problem to everyone, because even some of the cancers, we have found some good medicines are there, but the problem is that still all these medicines are good, to elongate your life, can prolong your life, but you will not be able to come into terms with your good life. So you, after getting, that is one of the main problem in the field of cancer. If you are getting some cancer, but in our case, what we say that almost everyone is having cancer. That is our concept. Everyone is having cancer. Only thing is that, it will come out later as according to your lifestyle. And once the doctor says, okay, you have this cancer or that cancer or something like that, then what happens? Almost all on a sudden, we start counting our end of the life. So even we all know that, we'll end, our end is certain, but we don't know when it's going to happen. And we think that, we can live forever. That is one of the kind of what we can say, that we will not think about whether we are going to die this time or next time, next day or something like that. We live it happily. But when we say that cancer is there and doctor is saying that within 5 months or 6 months or something like that, all on a sudden all our life to enjoy life is almost going down. So it happens, it's about some 4 or 5 weeks ago, one of our uncle, he is very happy, always cheerful, and he is actually always having this camera. That's why I have put these pictures. Always he's having the camera and taking pictures and everything, going everywhere. He's enjoying. It's the beauty of the nature. But once he analyzed he's having that cancer, so all on a sudden he shut down with everything. He is saying that he's in a mood that everything is dejected mode. This is the problem with cancer. But there are a lot of medicines now available, so to treat and these kind of things. But the problem is that nowadays the drugs which we are utilizing, kind of what we are having like this, we have a devastation, helplessness, fear, anxiety, and everything will come up. Everything. We were really good and we are living in a better condition, but all on a sudden it will come. So what we are doing nowadays as the medicine. So as a medicine, now we are giving, this is the thing, treatment, carpet bombing. So we are giving the toxic material. Actually, that to kill the cells, we have to give some toxic materials. Nowadays, what we are giving the toxic material. Of course, the cancer will be killed, cancer cells will be killed, but along with that, lot of normal cells will be killed. And that is the reason why you can prolong your life, but you will not be able to come out from this situation. That is the problem. So when we are doing the carpet bombing, you can see that everything will be devastated. So this is not our interest. Our interest is actually to develop these kind of things. Seals. Seals means if there is a culprit or one particular point we wanted to attack, we want these kind of multi-talented fighters. He can fight sea, air, and land, etc. So what we are looking for, these kind of multitasking kind of things, can be imaged, track and deliver drugs only to the sites, That's very important. We don't want to send this toxic material to anywhere in our body, only to the cancer cell. That is our interest. Only we kill the cancer cells, that's all. And we want to kill only the cancer cells, but it is not possible. Then what we can do, we can minimize the collateral damage. That's the thing, maybe 5% or 10% of normal cells are dying, it's fine, that's not a problem, but not all. And in that case, we have to provide immunity. And after clearing the cancer cells from our body, we have to check frequently and eradicate the possibility of a relapse. That is also important. So normally, even after some operation or something is there, again relapse will come. But our interest is not to come this one also. So that is why we wanted to put this nanoparticle or theranostics in our body itself, so that it can go through our body and it can check and it can find out where there is any relapse or something like that. So this is our interest, and this is one of the main works which we are conducting here in our BioNano Center. So how we can make this theranostics? So we can see that there are a lot of possibilities are there. So there are some compositions. You can see the nanoshells, liposomes, polymer particles, silica, iron oxide, quantum dots. These are different materials are there. And based on its physical properties, sphere, cubes, rods, triangles, and these kind of things. And we can use some of the targeting moieties. We want to target this one to particular cancer cell. And also we can modify the surface charges also. So by combining all these kind of things and putting these drugs inside, we can make these kind of theranostic materials. So how this one is working, that is what we have worked on, and we have developed a lot of subsidiary fields also into this. So for that, actually, we have made biomaterials, drug development, nanomaterials, nanobioimaging materials, and biochemical sensors to sense these cancer cells and other kind of things, and patterning of the materials, and theranostics. And now latest things, we have started working in the artificial intelligence in medical field to make this one is 100% deliverable. So I would like to mention basically on some of the nano drugs which we have developed based on our research. So you can see here some of the cadmium sulfate quantum dots and silica nanoparticles what we are used for imaging kind of things. And this you can see that we have made rainbow kind of things, almost all colors in the rainbow which we have developed for making imaging, a beautiful image which we can develop for detecting the cancer cells. And based on that, we want to see whether this one is a toxic material or something. What we did, we put this cadmium sulfate in the silica and we fed that one to some fish when it was in the egg form itself. Then you can see that, after 11 days, when this was a egg, we started feeding it. And when the fish is in the dermal came out, we can see that it's highly fluorescent. So that kind of things we can make, if even that itself is a fluorescent and is not giving any toxicity, that clearly means that these kind of materials can be used for imaging purpose. This was one of our earlier works which we have published. Then there's some real problems in the field of imaging. That means normally, what we are using for the imaging purpose, we have a biological window which we have using in the visible to the near IR region. That is this region. Normally we say that it is a biological window. Here there will not be any mixing up of our body fluids. Autofluorescence is there, so that there will not be that kind of fluorescence will be there. So, but still you can see that there are some kind of mixing will be there. But if you go to the second window, that is what we are calling it as the NIR second window. So there you can see over 100 nanometer to 1200 nanometer NIR range. So if that is there, then the imaging can be perfect, and there will not be any interference from our other body fluids, like water in our body and blood, and that kind of things will not be there. So we have developed material for our second near IR window deep tissue imaging. So you can see that it is very clearly, you can see even veins, and which is very good for imaging purpose. So Shimatsu company took this one for their imaging for the next level of imaging, second NIR window imaging, for to use that one along with their equipment. And for some making sensors, we need to have some selective placement of materials to be in this our grids. So for that, actually, we have developed a pattern so that we can make selective impregnation of materials on the selective places. So that also we have achieved by using our graphene materials. And we have used fluorinated graphene oxide for making multimodal material biological applications. For that one, with one material itself, we can image, and we can also do the therapy, and we can use it as a drug carrier also. So in one material itself, we are going to put everything. So that also became one of the very good publication from our side. And we have developed some gold nano particles for ocular imaging, so that we can see some problems in our eyes, so that it can, and we can also deliver some drugs along with that, and it can use for sustained release of the drugs. So then it can be cleared. So that also one of our work which we conducted. Okay, so before going into our nano applications in bioside, I would like to give some information. Maybe you will be knowing that, but it is just the beginning of just the introduction of that kind of thing. So you know that when we are using a nanoparticle, it's a big bulk-sized material. So you can see it's a sodium. It's a bulk-sized material. There is no band gap. So you can see that this valence band and conduction bands is actually, there's no that kind of things. It is coming, is close together. So, but this is NaN. We are using a lot of sodium atoms are here. But when we decrease that one, while decreasing it, you can see that the splitting is starting in the energy band, and you can see that small band gap is developing here. And again, when we are decreasing it further, you can see that splitting is becoming more and more, and the band gap is becoming more and more. So while it is going to the atom, this one, atomic level, you can see these kind of splitting. So what I wanted to mention that, the material which is the same material, same thing, but it will show a different property in a bulk material when it will come to the nano level. When the number is decreased, that is becoming nano level, and their property will be different, because you can see that this electronics property is completely different. And this is what I have explained here also. So you can see that when the number of atoms are decreasing in that molecule, then you can see that band gap is changing and entire property is changing. So what we are trying to use, we are trying to control the size of nanoparticles at different size. Then by doing that, we control is the band gap, and we fine tune everything for our use. So this is what we are doing it here. And I would like to mention about, we all are from the physics background. So I would like to mention what we have to understand a little bit to know about what is the work which we are doing in the drug delivery. So as you know that, when we are sending the drug inside our body by injecting IV in our body, that drug will pass through our vein. And there are two types of targeting of these materials as a drug. So one is actually, we call it as passive targeting, or we call it as a passive accumulation. So for this one, when we are talking about the tumor particularly, you can see here, near to the tumor, the blood vessels will be little bit broken, or that kind of things will be here, you can see here. So what happens when this nanoparticle is moving, and you can see that slowly it will go into this cancer cell, because this is actually is broken, and slowly it can go into that. So about size of about some 200 nanometer size nanoparticles slowly seep into that, and it will accumulate here. So this one we called as enhanced permeability and retention EPR effect. But this EPR effect is not enough to kill a cancer cell. Of course, we can target, and we can go up to some level of sending the drugs. Then what we are using is a targeting. We use some targeting materials. So we call it as active accumulation or active targeting. So what we do, we put some active molecules, just like some antibodies or something like that, or aptamers on the surface of the nanoparticles or nano drug. Then we put that one in our blood vessel. So then, while it is traveling through our body, it will go only to the cancer cell. it will not go to the normal cell, because as you will understand that, when there is a cancer cell, there are a lot of receptors will be there. Normally all cells we have a lot of receptors. So some receptors will be more in the case of cancer cell. So we will identify which receptors are more in that particular cancer cell. We'll tag only that receptors to the material on the surface of the drug, the nano drug, and we send into this vein. So by that way, we are always using this active for targeting the cancer cell, and we can put a lot of drugs inside this cancer cell. So as you can see that this is a biological cell which we are using, and there are different types of investigation into our cells, just like phagocytosis, mycopinocytes, and the clathrin mediated is going inside the drugs inside endocytosis. These kind of things are here. So what we are doing, like this one, there will be receptors will be here on the cell. So we will put some drug along with the receptor modules, and it will connect to this one, and in the endocytosis will taken place first. It will take inside, and this early endosome, which we called as this cell lines. So this one is actually, you can see there will be, you can see this kind of membrane, protein membrane will be there, phospholipid bilayer will be there. So it will take into this drug. It will have a like a loop kind of things will be there here, and it will take inside and this early endosome, and this will come to the late endosome, so that it will start taking out these drugs in from this one, and from this it will go to the lysosome, these particles, and from this lysosome drug will come into this entire the cell cytoplasm. And otherwise, after this late endosome, it will recycle, and this will go out, and it will still there, so that to receive other these kind of drug molecules into this. So this is the thing which is happening in the cell cycle when we are sending the drugs inside. So all the time there are different types of lysosome, and this endocytosis will be there, and then after this, these receptors will be recycled back onto the surface. So even after sending a lot of drugs, it will take it inside the cell and it will send it back. So by doing that, we will make sure that lot and lot drugs, and particularly it will go to the cancer cell. This is what we are trying to make in our drug delivery kind of systems. Then what we have to make sure in the case of a drug delivery, so we are interested to have the drug of the dose is very important. So normally if you are giving a first dose, then all on a sudden the dose will be increased in our body, and there you can see that there is a gap. This MTC, that is actually maximum tolerated concentration. We have to give a particular amount of drug, and there is a minimum effective concentration. So our drug should be between this. So we wanted to make sure that always drug will be in our body in between this window. This is therapeutic range. If you are giving more drug, that means it's a toxic range. We cannot give that one. And if it is less, then it is subtherapeutic range. We cannot, it will not give any good result. So whenever we are sometimes, we will give first dose, all on a sudden it will increase, and after some time it will go down. So while it's going down, we will give the second dose. Then you can see that it will come into the therapeutic range again, and again, third dose and fourth dose, like that, to make sure that this dose is here in the therapeutic range itself in our body, so that to give a right amount of drug always in our body. But actually, by using our nano drug delivery, our interest is this one. While it is there, the zero order controlled release, always there will be a controlled release throughout in our body till our aim is set, aim is achieved. For that one, we are using the drug inside, just like a packet. We are taking it and we are sending into our body to make sure that it will be always in the therapeutic range. And as I mentioned, there are a lot of possible ways to send this drug inside our body into the cell and to the lysosome and to the mitochondria, and then it will go to the nucleus, etc. So these are the pathways which we are targeting to send these drugs. And these are the different methods which we are utilizing to make these nano drugs. So sometimes, you should understand that always these drugs which we are saying is a highly hydrophobic material. So this hydrophobic material, we have to coat with some hydrophilic materials. Only then it can be interacted with our body cells. Otherwise, it will be rejected all on a sudden due to the opsonization and that kind of things. So we will always use this toxic material covered with some biocompatible materials. Then on that we will add some very good targeting molecules to deliver the drugs to the cells itself. This is our the initial types of work. Then what we started find that one type of drug is not enough because of MDR. There's multiple drug resistance are there. So some of the cells after sometimes it will show the resistance. So we have to put some 2 or 3 types of drugs in one capsule itself. Then we have to put maybe 2 or 3 sensors. It's like a targeting moieties on the surface, and we have to send it. Or sometimes what is happening when it's going inside our cells, and in the early endosome itself, their surface coating will be erupted. Means it can be gone bad. So what we have to do, just like we are sending the rocket, we will have 3 or 4 stage rockets to send the payload to the right place. We have to coat some 2 to 3 levels of biocompatible material, so that after our achieved some design strategy, then it can be gone out. Then the second biomaterial compartment will come out. Then it will go to the next level, and after that achieved, so it can be gone out. So like that, we can put like that kind of things, so that it can go to the right place where we are attaching or mitochondria or nucleus or any other kind of places like that. So we have to make multiple that kind of things. Along with that, we have to monitor where this one is going, and that is why we have to put the imaging moiety in our drug, so we can track where it is going, whether it is going to the cancer cell or some other places or something like that. So sometimes we can use the PDT, photodynamic therapy. So first we will inject this the drug. After finding that this drug is going, and we will give some 4 or 5 or 6 hours or maybe some 24 hours of time, so that all these drugs which is going inside the cancer cell, and then we will check whether it has reached that place. So that one we have to image it. Then after reaching, and we are making sure that it has reached, then we will use our laser, NIR laser, and to give the shock. Then it will give the photo PDT effect, and it kill the cancer cell, and only the cancer cell we can kill. So like that kind of things which we are doing in different kinds of strategies. So I would like to, though we are working in different fields, I would like to mention some 4 of the different strategies which we have used and achieved some very good results. So in that, we have used the theranostics, as I mentioned, is therapy and diagnosis, or theragnostics sometimes you can say here. That is also okay. We use both sometimes. So this one is a triple targeted dual drug silica nano formulations. This is what I am going to type. Triple target. That means we wanted to make sure that it is going only and only the cancer cell, and we'll have a dual drug. 2 drugs will be there in this silica nano formulation. Then I would like to discuss about some copper-based nanocrystals for cancer theranostics. This copper which we have used, we know that that for imaging, quantum dots making, we can use cadmium-based materials, but cadmium is not that much good for our body. So our aim is to remove this cadmium from this group, and we wanted to use copper-based material, so that it is little more biocompatible. So we have achieved that one, and we have got some very good results from that. And we have used this combined nanotherapy and immunotherapy. So like nowadays we are working to get some immunotherapy against the cancer. because we don't know where and at what time the cancer is coming, cancer is starting in our body. So our aim is now, almost all work is going not to find out only the drug. We want to find out some immunotherapy so that we should be immune against the cancers. And for that we have tried to use gold nano cages we have developed to send this drug and to make that kind of results. Then we have used this hybrid solid lipid nanoparticles to work against the brain tumor. This is very interesting work because brain tumor, you should be knowing that our brain is wherever you can send the drug, which can reach. There is no problem. It's not a big issue. So, but if you are sending the drug to the brain, our brain is actually very well protected by BBB. We call it as blood-brain barrier. It's very tight. Even we wanted to send a drug which is good for us, our brain will not allow it. It will throw it, it will reject it. So for that, we have developed a very good drug by using hybrid solid lipid nanoparticles to target into the brain tumor. These 4 things which you would like to mention briefly in this presentation. So first, I would like to discuss about the triple targeted dual drug silica nano formulations. So you should always remember, what I have mentioned about how the drug is going inside the cell and how this one is taking up inside our each and every organelles. So this is what we are targeting these organelles in different work. So here what we have developed silica based nanoparticle. Silica is really very good biomaterial. So for that, what we did, we have put 2 drugs inside, tamoxifen and one more drug which we CF7 we have put inside. And when we have checked that one by putting inside the mouse, we found that these MCF7 and HUX cells and L929 cell lines, these are the cell lines. First we work on these in vitro conditions, whether our work is right, whether it is giving a good results or not. So in that we found that the L929, this is the normal cell line and these are the cancer cell lines. So as you can see that, so when we are used a non-targeted nanoparticles, non-target means there is no targeting. So at that time, when we are used, this one has gone to MCF7 cells, HUX cell, L929 almost in the same way. So, but when we started using some targeting moieties, here we have used the FT, we have used that one, and we found that this cancer cell is having more silica particles attached on the surface, and HUX is also started getting this one compared to the normal. Of course, we cannot leave out, as I have mentioned, we cannot leave out it is going to and not going to the normal cells also, but the difference will be high. That's what we have mentioned. So always we say that in the earlier case it is distributing everywhere, but when we are using targeting, we can send the more and more drug into only to the cancer cell. Here you can understand that why we are using this therapeutic range. I think I have showed that one. You have to make minimum that much drug should be there, then only the effectiveness will be there, otherwise it will not be effective. So in that case, whenever we are giving more and more drug to the cancer cells, these cancer cells will get affected. These normal cells will not have that much therapeutic drug will be there to kill these normal cells, so it will be spared. This is what the technology which we are utilized. So by utilizing that, we found we can kill more these cancer cells, and it can be spared these normal cells. So these are the way which we have conducted. So here you can see that some of the work which we are showing how this one is affecting this MCF7 cells and this HUX cells and L929 cells. So you can see that whenever we are using the control things, control means the normal things, so at that time it will show there is no change in their morphology, in the actin filaments and the filaments inside our cells. It is not showing any disruption. But when we are using some treated one, you can see that there's a disruption is happening here. this actin filament and all the kind of things. So that means it is getting affected. Similarly, you can see that in the control is L929, you can see that it is almost same. There is no change. It is not at all affected, this drug. But you can see that MCF7 and HUXL9 is almost finished. By the day 3, it has been finished off. Same way, these are the different types of experimental checking to make sure that we are targeting only the cancer cells, not to the normal cells. So here also you can see that HUX cells and MCF7 cells are actually destroyed, but in the case of L929 cells, it is not that much affected. And you can see that this is a VEGF factor, that's vasculoendothelial growth factor. So normally, whenever there is a cancer in our body, this cancer needs a lot of food. So for that, it will develop its own the blood vessels. So it will spread out. So it will take some others food also, some normal cells food also. So like, it has to spread and it will create its own blood cells. So whenever there is a vasculoendothelial growth factor is there, then it will develop this kind of blood vessels by its own to get a lot of food for its development. But when we have used this our drug, we found that we can finish this development of this endothelial growth factor that developed these blood vessels. So this one is actually killing both ways. One drug is actually we have utilized to give the drug to kill the cancer cell, and the other drug is actually used to cut the blood vessels, nearby blood vessels. So in that way, actually, we are choking. We are not giving the food into the cancer cell, so that by both ways we can kill the cancer cell. So it became a very highly effective strategy to kill the cancer cell. And when we put this one in the treat in the mouse, we found a very good results. So here you can see that this and silica nanoparticles, when we have used this NIR dye, that's why you can see it's a red color dye along with the drug. So when it is use the silicon nanoparticle for non-targeted cancer imaging, is non-targeting, there is no targeting. So what happens, you can see almost, as you know, whenever we are giving some food or the drug or something, normally it will go first to the liver. You can see that, this is liver of this mouse. So almost all things are going into the liver. Whatever the things happen, first it will go to the liver. Then from there it will spread out. So in the case, if you are in the case of we are non-targeted case, you can see that almost everything gone into the liver, and the other places like brain, heart, lungs, and other places, it is very less. So what we did, this doxorubicin loaded silica nanoparticles, when we injected, then here what we did, you can see that there is a accumulation of drugs here. So why this accumulation here? Because we have developed a cancer, the tumor on the mouse at this area. And when we use the tail vein injection, when we injected, this drug has gone inside and circulated, and it has been started accumulating here. And initially it was like this, but slowly after giving 3 to 4 hours, it started accumulating here, so that all other places had been leaved. So that means we can target it and we can put the drug into the cancer cell itself. And when we did this one, we found that if it is non-targeted, the fluorescence of the drug, which is actually showing how much drug has been gone into the particular place. So when it is non-targeted, you can see that the fluorescence is very less. That means the drug not reached because of the non-targeting. So when we have increased this 1 targeting, 2 targeting, like that, when we have put slowly it started increasing the fluorescence. But we found that when we have used the 3 targeting moieties, the fluorescence became significant, highly significant. That means it has gone very clearly into this drug, into the cancer site. So that means it has been highly utilized to reduce the tumor mass. So you can see here what we did after sending these drugs inside, and multiple times we have treated that mouse using our drug. So then we kill the mouse and we will find out what is the size of the tumor mass later, taking it out of the treatment. So in the case, if you are not given any medicine or any kind of things, just normal, then the tumor will be increased and the size will be like this. It is very big, and the mouse will be died at this stage. And you can see that when we are using some targeting, some medicine, some drug used, and you can see that the size has been decreased. So like you can see that it has been decreased. And when we have used the multiple targeting moiety, we found that it has decreased to a very, very small level one. That means you can prolong the life of that if you are giving this medicine to the human being. So that clearly means that you can prolong the life without any problem, and it is not without killing any normal cells, and maybe it can be extended the life without any other problems. This is what we have achieved in this case. So it was, after getting, it's a really a good work. So but still we found that to make this drug, we have to put 1 or 2 drugs inside, and we have to make a coating, and again we have to put some of the moieties, a lot of work which we are conducting. Then we started thinking why we can do everything together, delivery of the drugs and like a killing effect, that means photodynamic therapy or something like that, but it's not be that much toxic when you are sending inside our body. So our search actually reached to find out some copper based nanocrystals for cancer theranostics. So in this case, what our interest is to make copper based nanocrystals. This can be activated from outside by using NIR laser. Then after getting the NIR laser, is because of the resonance, plasmon resonance, it will give some heat and it can kill the cancer cell selectively. So in this case, what we did, we have used the copper nanoparticles. Then we found that when we inject that one into the cancer cell, it will go and it will accumulate here. So you can see it here after targeting the copper by using the targeting moiety. So it worked very well, and also it is showing very good fluorescent light. You can see that this one, when we will check it, we can find out that it is emitting this red color, so that we can clearly we can locate that it is there. So after, and also you can also see using the CT also, you can use both ways, photoacoustics and as well as CT you can use, and we can find out the imaging. By imaging we can find out that it has reached there. Then we will use the laser, and by that we can kill the cancer cell. So here actually we can find out this from this image. Actually we compared, actually this is our material which we have developed is a nanocrystals, and this is DOX fluorescein. This is a normal imaging moieties which we are utilizing for imaging. We compared that one with our material to find out whether this one is also giving a very good fluorescence image. So we found that after treating this one, after 30 to 60 and 90, 120 minutes, all these, our fluorescence is increasing and is intact. It is getting a very good fluorescent imaging, the very good imaging color compared to this DOX fluorescence. And when we are treating this one with the normal cells, control, we can see here this calcium. Actually this one is actually showing that the cells are viable. That means the cells are really good, healthy. There is no propydium iodide is release is not there. That is not treated. Is not interacted. So in that case, if this propydium iodide signals are more, that clearly means that it can provide only by the dead cells. This is called live dead cells assay. So if it is calcium is more, that means all these cells are live cells. If this one propydium iodide is showing the red color more, that means the cells are dead. So here you can see that after treating this copper, and once after giving this radiation, we found that most of the cells died, and some of the cells are spared here still, but we achieved our result. This is the same thing which we can clearly see here. So by using this kind of method, we can use the copper nanoparticle for imaging as well as killing. That means the theranostics has been achieved here. And you can see that we can use this one for the selective killing also. We can see that when we are giving the cancer cell with the treatment of this copper nanocrystals, we can see that we wanted to kill only this area. So what we did, we have treated this copper nanoparticle with the cell lines, and we have irradiated only the limited area. We don't want to go outside. We can very selectively irradiate it only to that cell, and we checked whether it is achievable or not. We found very clearly that by doing that, we can kill only the selected area. And you can see that this area, there is no calcium. That means this area is all cells are died. That just outside you can see that the cells are live. Here you can see that the cells are died. So that means very pinpoint. We can pinpoint very clearly. We can kill. So like what we are having this problem in the cancer therapy for just like we are using the surgery. The doctor will check the imaging earlier, just like before going for the surgery and that kind of things. He will take the picture and will analyze in this area. But that doctor will not stop there, because it is showing the cancer cell lines. The image is little bit grown stage, but there are some other cancer cells nearby areas. So what he will do, he will cut all other areas also, nearby areas. So that means a big chunk of the cell lines or cell mass has to be removed from our body. So suppose if it is happening in our brain, so he has to cut almost a very good chunk of the part of the brain to remove this cancer. That is actually very difficult, and it's not possible at some certain areas in our body. So there what we need exactly that place has to be taken out. For that one, this laser type killing is really achievable, and we can target the cancer cells specifically to these areas, and by getting the very good image online, we can say that it is simultaneously we can image it and we can kill that one. That is the advantageous thing. So most of the things will be there, because by doing that, the relapse, we are negating the chance of relapse. That is what we are doing. We are trying to do, so that most of the cells will be killed. It's a very good advantageous thing in our work. And you can see here that even after sending these copper cells in this nanocrystals in our body by control 7 days or 60 days, we cannot see any change in our cells. So everything became intact even after 60 days. That clearly means spleen, kidney, brain, liver, where all the cells are intact. That means it's not at all created any problem to the other cell lines. It has killed only the cancer cells. This became one of the very big achievement from our side. And then what we did to increase the imaging, as I have mentioned, the window, as there is a one window is there, that's the biological first window, then second window, NIR windows are there. So what we did in that case, we have made the copper bismuth sulfate as a theranostic material. The same methodology we have adopted, but we have used to shift the energy level. As I have told earlier, by using different materials, different atoms, we can change the band gap and change the electronic structure. By doing that, we can fine-tune these nanoparticles for our purpose and to the this absorption and its emission range and these kind of things. So by doing that, we have achieved a very good result, and we found that this material can be imaged. So here we found that in this rat, mouse, we have made a cancer here and we injected it, and we found that it is very clearly the mass has been recognized, and you can see here it's very clearly we could identify it has gone only to the cancer cell. Yeah, that means the targeting is very good, and we can get a very good image also. So these results which shows that without the help of the cadmium related toxic kind of materials, by using highly biocompatible materials, we can use simultaneously the theranostics effect can be produced. This is one of the achievements which we have developed. And you can see this one on our mouse treatment, and we have irradiated to show that we are killing only the cancer cells. So you can see that this cancer, we have developed it here in this area. Okay, so you can see here, and after that we have imaged, that is clearly showing where is this picture. This you can see that it is clearly, we can locate it. And after that, after the irradiation, you can see here, if it is a normal one, when we have used the saline to just like to checking it, saline and NIR means there will not be any targeting. Just this one is going, and when we are using NIR, now effect can be seen. When we have used this copper bismuth, and if it is copper bismuth, this material is there. Even if it is there, it is not killing the cancer cell. Not cancer. It's not a toxic material. It will not kill the cancer cell or normal cell or anything. That is the advantageous thing. But after finding and after imaging it, we found that okay, it has reached there. Then we irradiate with NIR laser. So then you can see that what is the stage. It has been charred out. It can be killed out. So in that means, even if we are taking this drug inside, there is no need to worry whether it will be killed. It will kill the normal cell. No need to worry about that. It is highly biocompatible and it will not be killed. So we have make sure that it will be killed only the cancer cells. Then some of the results based on that, we have to show that it is really good. And we have developed a copper telluride based materials also we have developed for this theranostic materials, and to show almost the same kind of results which we have produced. And we found that it is going only this cancer cell, and it can be highly toxic material. Cell viability, you can see that if it's a control, it is like this. But when it is coupled with drug and this nanocrystal, the toxicity is very high and it can be killed the cancer cells. So this is after a very good work. Then we started thinking, okay, that work is really good, and we found that okay, we can kill the cancer cells. Okay, fine. Then what is there? This is only a drug. What we can provide is an immunotherapy, like it can be immunization for us. So for that, actually, we have developed a new strategy to develop a new drug for using the gold nano cages. So as I have mentioned, this combinatorial nanotherapy and chemo and immunotherapy. But in that case, what we are trying to use, we will kill the cancer cells by using our nano drugs, and there will be some antibodies are present. It can develop some immunotherapy to our body also. So for that, actually, we have developed a gold cage, nano cage we have developed, and we put the drug inside as well as some antibodies inside, so that it can then it deliver to our our cancer cells, and we have developed it. So here, we have developed a very good, interesting kind of things to kill the cancer cells. For this strategy, we have developed for targeting this estrogen, progesterone. This is actually we have used for the targeting this one, this cancer cells, and this triple negative, almost all, even it's a triple negative. That means there is no receptors on the surface of the cancer cells, that we call it as a triple negative breast cancer cells or cell lines. There will not be any receptors will be there. That is one of the rarest case, and it's very difficult to treat that kind of breast cancers. So even when we have used this our method, even at that stage also we can kill the cancer cells. That is the advantages of this development. We call this as theragnostics gold nanoparticle stand. We have provided the names as a TAN. For that, we have utilized this material by using Moran coating, hydroxytamoxifene. We have utilized as a drug, and anti-TROP2 antibody we have developed for this one, for targeting. And this is one of the nano shells which we have developed. You can see that initially it will start with the silver nano cubes first. Then we start replacing this nano silver by using gold nano atoms. So then slowly it will be replaced, and you can see that there are a lot of holes inside. So you can see maybe this one, you can see some holes. Maybe if it's a big picture, you will be able to see this one. So this is the thing which we have developed. So you can see that this is the nano particle, but after the treatment, after some time, you can see that there are a lot of vacuum and actually created inside this gold nanoparticle. So what you can see here, there's a cage, this is a hole we have developed, so that what we did, we have put the drug inside through this hole inside. So like that also we have developed a lot of drug encapsulation inside these nano cages. These are some characterizations to show that we have developed successfully this gold nano cages. So I'm not going to explain those kind of things. So here actually what we are trying to show that this SKBR3 and MCF7 cells which we are used as cancer cell lines, and there are some, as I have mentioned, there are receptors will be there, and to the receptors, this nanoparticle will attach and it will get inside, it will go inside and it will go inside. But the advantage of this one, these kind of things, when the tamoxifen and this drug is here, it normally attacks the mitochondria. So when it is attacking the mitochondria, so just then if it is attacking the mitochondria, normally there will be killing of the cells. This is a different types of killing. So earlier what we are trying to use, we send this material, the drugs and everything, as I have mentioned, there will be endosome, and through this endosome it will go to the lysosome. So all these drugs and other things will fuse with the lysosome. Lysosome, we can say that is a dustbin in our cell lines. So whatever the things which we are taking inside, it will be initially checked by on the surface, and it will take this one by the endosome, and it will take slowly into the lysosome. Lysosome is normally about, the acidity will be about some 4 to maybe we can say that 3 to 4 is the pH. That means highly acidic one. So when these kind of materials will go into the lysosome, because of this acidity, the covering of the biocompatible material and all the things will be burst out. So while it is bursting out, the drug which we have given inside, it will also come out. So it will spread throughout the cancer cell, because if it's accepted only the cancer cell, this cancer cell will be died. So then that means it can be targeted, highly targeted, and killed the cancer cells. Then after that, these killed the cancer cells, this become a debris. This debris can be taken away from our body to our body fluids and all the kinds of things. Normally in the waste, how the waste is removing from our body, it will be removed. Some of the materials, if it's like a car, just like in this case, if we have used the gold nanoparticle, cannot be taken away like that. So that kind of things will be removed by lymphatic drainage. So whatever the case, it will be removed from our body without any problem. So there is no need to worry to use these kind of materials. So there are, by using these kind of things, there are 3 types of killing can be there. There's a pre-lethal, often reversible. So sometimes, if we are giving this drug, it's not that much lethal. So there will be some problem for these cell lines. Normally it will be affected to this mitochondria for this while we are using these nanoparticles. So these nanoparticles actually, after sometimes, this it will be repaired. So our body always try to repair itself. So it will be repaired and it will come into the stage as earlier. It will come back again. But if you are giving more and more these kind of materials, then it will reach the point of a no return. It will go to the cell death. There is no other way. It will die. So this is also there. Along with that, if we give more and more drug into that, it will go for necrosis. That means necrosis means it's a sharp killing. All on a sudden, we are giving a shock to the cells to die. That kind of death is necrosis. So other thing is a normal cell death, just like a programmed cell death is there, and sometimes we can give the some toxic elements to the cell to die. So that is a normal kind of that we can say. But we are giving a very big shock, then it will go to the necrosis kind of things. So there are three types of cell killings is there, and in one case is a pre-lethal, then often it will be reversible kind of things. It can go to the reversible things. So these are the different types which we are mentioning about apoptosis. Apoptosis is the normal programmed cell death. Normally we say that it is a normal cell death. It will be dying, and some kind of there are some oncosis also will be there. So these are the types, and if it is apoptosis normally, and in that case what happens, the monolayer cultures cells from the cytoplasmic, it's blobs actually. We can see that the cells are becoming blobs and start slowly is dying. There's chromatin clumping occurs, and later the cells pull apart from the because if you are doing say in vitro work, you will be putting that in a base. So from there it will detach, and you can see that it is floating and it is totally blobbed and it is actually killed. It's died. So that kind of things which we can see if you are giving these things. So there is a very good kind of thing which is happening is autophagy. This is actually nowadays we are talking more about this autophagy kind of things. That's why earlier in our house, I think some of them will be knowing that in our house, we say that in 1 month we will say it's orical. We say that in Malayalam, orical is taking. That means for 14 days. After the 14 days, for 1 day, you will not take any food for 24 hours. Actually, it's really it was there in our culture. So we are not aware of what is the actual meaning of that, what is the actual importance of that one. So now we found that this autophagy or this kind of process in our body to kill the unwanted cells as well as cancer cells and other kind of cells, it will be killed when we are not giving any food to our body. And at the time of scavenging, the cells will started killing these unwanted cells, cancer cells and all kind of things. And this is known as autophagosome. So this Yoshino, Professor Yoshino is found this one later by scientifically he mentioned, and he got the Nobel Prize. But our culture, we have already doing all these things, but we are not telling this one scientifically. That is the problem. So it is good to have that kind of thing at least around intermittent, or maybe after 15 days or something. It will be cleansing our body. So this is the same thing which we are trying to use in our experiment also. So what is this autophagy? Normally we will give a starvation for the cells to give the food. So at that time what happens, a phagophore is developed. So when we are sending some nanoparticles or something like that, what they will do, and it will escape this endocytosis route. There are some pathways are there. When it will escape the endocytosis route, our body is our cells and our body is very smart. So it will find out that some foreign particle is coming inside. So what they will do, it will go and it will engulf. So this is called autophagosome. So it will engulf that particle and it will take it, and it will take all these things through the cells in our cytoplasm. It will go and it will connect to the lysosome. You can see that it will making it, this particle, we found that this is a foreign particle, and it will be covering it, this phagophore, and it will moving, it is actually moving and actually connecting into the lysosome. As I already mentioned about the lysosome. Lysosome is the waste bin. It will trash because of the high acidity. So what it will do, it will give and it will connect to this one, and the materials which is not have been digested, it will be given to this lysosome. It will clear it off from our cell cytoplasm. Same way which I have mentioned earlier, endocytosis. This is actually coming early endosome. It will connected to lysosome. So both ways, we can give and we can connect to the lysosome, and it will be thrashed out. This is the way which we are killing these kind of things. But in the case of autophagy, is a really interesting thing is that this autophagy is very interesting. It's very check first because they found that in the cell something is going wrong. It will detect. So what they will do, it will first check where is the giving this energy. to make the cell division and all the things and for the work. They found that, okay, this mitochondria is doing that. So what they will do, all on a sudden, this will go, if something is happening bad, it will go and attack this mitochondria first. And if mitochondria itself is in a difficult situation not to work, definitely it will be engulfed and will take into the lysosome and it will be killed. So when this is actually in a starving condition, it will take more and more this mitochondria, even if it is not bad, it will take, because the cells need more food. So our body will think that there is no need this much cells. So kill these other cells, like very weak cells and not that much good, healthy cells. So what they will do, all these cells will start dying itself. So it's a body is having a very good system, resistance system for all these kind of things. If we treat our body well, then we will live very happily. So what they will do, they will first attack this mitochondria and it will kill. And in that case, the cell will die. Normally, if there is no energy, it will be died. So what we did in this case, we put these gold nanoparticles, and these gold nanoparticles, normally it will come out through this one. Sometimes it will be endosome kind of endocytosis will be done. Sometimes it will go inside through this one, some other type of entry. So it will go, and it will, the advantages of this nanoparticle is we are trying to give the targeting towards the mitochondria. So our aim is to kill the mitochondria first. So now it will attack the mitochondria. Then when it is going inside, the mitochondria will start having some problem. All on a sudden, this autophagy, this phagophore will understand there is some problem in that, it will engulf and it will kill it. So this is the thing which we did in one side. Along with that, we have used some drug also into that. So the drug will go into the lysosome. The other one will go to the gold nanoparticle will go to this mitochondria, and both ways we will make sure that it will be killed. Along with that, we can see these are the mechanism of nanoparticle toxicity we have utilized in our work. So I am not going into discuss detail that these are the pathways which we have utilized to kill the cell. So just briefly, I can show that this nanoparticle which is coming into the cell and it will be engulfed, so that it will go inside and it will go and it will find out this is the phagophore formation, and you can see that once it is there, it will make the phagophore formation and it will directly attack this mitochondria. Okay, you can see that very clearly. It is attacking mitochondria, and then mitochondria is finished, then the cell apoptotic cell death will be there. So otherwise what will happen then, if the things are coming out and it is having some problems, it will give, again this phagophore formation is there, it will go for autophagosome and it will go in this line and it will be cleared. All these things will be exploded into this cell, because number of drug as well as nanoparticle we are giving inside more and more, and even lysosome cannot be digested. So all on a sudden it will burst out. So by doing that bursting out in that way, we can reach the autophagy cell death also. This is what I have mentioned earlier. Both ways we can kill the cancer cells. These are the pathways which we are tracking to kill the cancer cells. We have successfully showed this one. MCF's breast cancer cells, it can be killed. And these are the some of the data which I wanted to show. And we have used this anti-TROP2 antibodies also for creating some immunotherapeutic kind of things, means effect which we have developed. So yeah, so here actually we have used some 3D construction of MCF7 after treating the TANs. And you can see that some of the mitochondria here, you can see some mitochondrial kind of things. You can see here the gold nanoparticles actually going inside. And when we have used this SBF method, whether we have cut the cell lines and we have imaged it, we found that exactly this one is going into the mitochondria and it can be killed. So in that case, we can say that some mitophagy is happening to kill the cancer cells. Is a type of cell death which we have found. And there are many other processes also happening, but I don't want to explain more into that. So but what we did, we have tried whether the things which we are mentioning is actually happening or not, whether it is actually going into the mitochondria and it is killing. So for that, what we have used subcellular TEM images, and we found that this one is actually going inside, and you can see that some kind of blubbing is happening in this mitochondria. You can see that in this entire, the shape of the mitochondria itself is gone. You can see that it is very clear that is not the shape of the mitochondria. It has been disturbed and it is destroyed. So in that way, it is we have shown that it is highly possible. So there are we have also worked in what are the different kind of cell death is happening, whether it's autophagic or apoptotic cell death, or is individual or both parallel. This is what we have checked to find out what are the kind of things which we are actually prominent in that. But later we found that in both ways it is actually killing. So that means the effect of killing is very high. So that, you know, we can say that, as I have mentioned, that therapeutic index is really good. Even we are using the less amount of the toxic material, as effectiveness of killing is very high. So that, you know, there is no need to worry about taking these kind of toxic materials inside our body. So it will not kill the normal cells. This is the advantage of this kind of work. So then these are the different ways we have to characterize, and we have showed that yeah, this is what I have mentioned. This autophagosome is actually creating, and it is actually going to meet to give with the lysosome. This is what we have showed. You can see that this one is actually creating this cell inside the cell. Slowly, this one is there is a mitochondria. You can see very clearly. This mitochondria is actually engulfed by the phagosome, and it is gone and giving to the lysosome. This is what you can see. Lysosome. This is actually, it's a big lysosome. It's actually, you can see it is going. So we have checked it, and we found that it is actually going inside and killing. Then this is the same way, and the damaging of there are different kind of damaging also apparently happened to the kill the cancer cells, and one of them says their ER is also is we could damage that one too, but mainly the mitochondria we have damaged. So that what we were interested, and it gave very good results. So but along with this TAN, that means the TAN which we have utilized, it has also not only it has gone only the mitochondria, it has gone different subcellular organelles also. So we found that it is going to endoplasmic reticulum here as well as the mitochondria and these kind of things. Then what we used, a different kind of imaging system we have tried to use, and we found this yellow color, which you can see that these are the nanoparticles which we have given. So we found that, you know, where this gold nanoparticle had gone, and where are the organelles, and where are these places it has been gone inside the organelles. So we found that it is mainly it is going inside the mitochondria, but along with that it is actually going inside the LR also. So that is also giving a very good result, showing that there are another possibility to target and kill the cancer cells. So there are multiple ways we can use this one to kill the cancer cells. So the different degradation of mitochondria and mitophagy and apoptosis, different types of ways which we have used by using the FIB-SEM. So you can see very clearly that the cells have been divided, and we have checked where are these mitochondria, and there are different ways of characterizations to make sure that what we have mentioned is absolutely right to show the outside world. We have mentioned these are the pathways we have followed, and it has been used to kill the cancer cells, and we have achieved those results. And particularly we have used the tomography method to show that how this gold nanoparticles is entering into this mitochondria. That also we have conducted. So we found that after reaching nearby the mitochondria, there are some inoculations can be happened, and slowly this one is going inside by making some interruptions on the surface of the mitochondria. So we can also see that what are the different pathways, how this one is entering into the mitochondria. That's what we have imaged and we have showed it. So these are the places, we found this is intact, and you can see that these are the places where small pores are coming, and through the small pores, this one is coming more and more nanoparticles inside. So these are the things we have imaged it, and we have showed that this is the ways to get these nanoparticles inside. Okay, so of course these are different ways, because in journals, they will not understand, they will not accept all on a sudden when we are saying this, and we have to show a lot of results in different ways. So these are all these results. I just don't want to because we are reinstating that, okay, this is the thing we did, okay, this is the thing which we have got by using different methods of bio analysis. We have showed that. So ultimately what we did actually, this multimodal targeting theragnostics with using the gold nano cages, we have achieved our result to kill the cancer cells. And and as you know that this gold nanoparticle is really good for surface plasmon resonance. This surface plasmon resonance can be utilized to elevate the heat and by killing the cancer cells. So not only by using the drug and that kind of release of the things and going inside the mitochondria, it can be killed. But along with that, we can also use this surface plasmon resonance by using NIR laser. We can also kill. So there are multi kind of different ways to use the cancer cells. So we'll make sure that this will be this cancer cells is killed. So then as a final one, which I would like to mention about this hybrid solid lipid nanoparticles against the brain tumor. So this is the lipid nanoparticles which we have developed, and so I will go quickly into that. And these are the different work schemes we have utilized, and we will come to the results. So we have used the drug coursine, and we have used some moieties so that can be targeted. So you can see that after 6 hours, 24 hours, 48 hours, this is the mouse brain. So we have utilized, after finding out whether there is a two targeting moieties, you can see that this is the actually cancer which we have, tumor we have developed, and by using our drug we could locate it very clearly inside this into the brain. That is very beautiful work which we have conducted. It's very difficult to send the drug inside the brain, but we achieved it, and we are targeted, because the brain, the importance of brain. If it is going to some other parts of the brain, then it is really a tragic thing, and it will create some problem for our brain, and some other functionalities will be lost. But here we are pinpointly, we can kill, we can target to the cancer cells, and these are some characterization to show that our drug is actually working very well. But my interest is to show very clearly and show that mouse is killed. Actually, the drug cancer is killed. So this one actually, what we did after the treatment of the mouse by using our drug, what we did, we have checked, it's a behavior analysis. So normally what we, I don't know whether you have seen when we create the tumor inside a mouse, for the initial 2 to 3 days, it will run here and there as normal. So slowly when the cancer is increasing, the tumor mass is increasing in its body, slowly it will slow down, and after some time, maybe 5 or 6 or 7 days, slowly it will go, and it will sit in nearby a cage, and it will not be able to move, a bit like it's just paralyzed kind of things. So what we did actually, after that mouse reaching that stage, we started giving the drug. So after giving that drug, we found after some 14 days, it has been regained all his functions. That's very remarkable kind of work which we conducted. So we found that even after it has gone to that stage, we can recover it, we can take it back. So then we checked, it's a behavior analysis. Then after some days, it started again jumping as a normal mouse, it's going here and there. And later we checked it, after killing the mouse, and we could not find out whether the cancer cells inside that one. So that much effectively we killed the cancer cells for some of the mouses. This is really a remarkable work, and we have got patent for this work from our government and from Japan, and we have now filed a patent to get from the US also, because it's a collaborative work we have conducted with our MD Anderson Cancer Center. So yeah, this one actually wanted to show the result. You can see that, when there is a control, which we are not giving any medicine, the mouse, the cancer, you can see very clearly it has been is very big, and it has been the mouse was died at that time. So when we have used only the medicine, what is the stage? This is reduced, but not that much good. When we have used the targeting moieties, only one, this is just like that. RGD and TF, these are different targeting moieties we have used. But when we have used all these things together, the dual targeting moieties and the drug, we can see that, here you can see some lighter spot where we could see that where we have given the cancer, but you cannot see any cancer there. It can be taken out. It's a very remarkable achievement. So when we found the survival rate work, this is the survival rate work which we conduct. So we'll start with the number of mouse is here. Then we found that after this 20 days, almost all mouse died. So control is all died by around 20 days. Then by using coursine, non-target, and all these things, it will be giving 20, 21 days, 25, or maybe around 30 days, almost all things died. But when we used this, our brain tumor drug, you can see that, it is here, and even after 40 days, 60 days, 80 days, it has continued. It has not died. That is really a remarkable work. So even our research, which we are saying that even if in the mouse case, even if we can increase the lifespan of that mouse at least 10 or 14 days or 20 days, that means you are increasing the lifespan of human being more than 20 years or something like that. That is the stage. Or in that case, if some person has been recognized some cancer or something at the age of 50 or something, normally it can go up to 70 years of age by using that kind of drug. But in this case, you can see that nothing happened. So that means it has been left, that drug, by using that, can irradiate cancer from your body. This is a really remarkable work which we have conducted, and we have got patent on that. So this is actually we wanted to achieve. So selectively kill the cancer cell, not by damaging even any normal cells. So this is the work which we have already shown in a bigger scale, which I have shown. So it is really good, and we have achieved the result by killing all the cancer cells. So this is what we wanted to achieve. The theranostics is selectively killing the cancer cells. There is the person we wanted to kill, only that, not any other collateral damage. So this is the major advantage which we have achieved through our work. Then what is going to the next? Okay, we have achieved this. What we are going to do? This next level of working is actually we wanted to integrate artificial intelligence into this imaging and treatment kind of things. So now also the problem is the medical imaging is just like, is a qualitative imaging. If you are taking from the top or some side or something, normally we can see this one. This is here, okay, that from the top. But actually the situation, it is very deep inside, very difficult. The quantitative measurement is very difficult. So that is why, even doctor, when you are using this cancer treatment, what they are using, they take the cells, not only here, they will go in and around like this area in total, and it will go into deep also. But they don't know whether they are actually taking out. We cannot blame them. This is a problem. It's a deficiency from our side. So to give a third eye, that may means in here mentioning is another kind of angle to show that the depth also we have to be analyzed. So that we can utilize by using integrating this one with artificial intelligence. This is the work which we have taken up now. So slowly some of the imaging machines, just like IBM and Philips, Agfa, all these companies are slowly started that one. So we are trying to augment by using the nanoparticles into this cancer cell, because when you are putting these nanoparticles more and more into the cancer cell and will be going in, so you can see that, like in the picture, the pixels will be more. When the pixels will be more, this clarity will be more and more. So this is what we wanted to give. Otherwise, what always nowadays the doctors will be getting is a vague picture. By that, they are calculating by their experience and they are doing it. But here what we are going to do, we are going to give exact picture with the quantitative and qualitative measurements. Everything will be there and we can deliver it. That's what we are trying to use. So that is why even in medical industry, if you are giving this analysis or something, when say that more than 30 to 40% analysis wrong. This is very big trouble, a very big problem is happening in the field of analysis. So that is why what we are trying to utilize the artificial intelligence into this, and so that this should be controlled minimum less than 1% or something like that. We wanted to make sure that. So that is why recently even some I with the picture of eye, we can predict the coronary disease. So that kind of things are slowly coming up. By using some picture or something like that, we can predict what is going to happen. So this is what our next interest by using this nano thing. So naturally, we are interested to make a human on a chip. That means we are going to replicate as such in a chip, so that by making the pluripotent cells, we can make as such the human being. Then by connecting this one to the artificial intelligence by using some fluidic biosensors and nano-related sensors, and using your own blood, we can analyze what is your health, what are the problems, and how to be conditioned, when this cancer can set in, or maybe another problem can be set in your health diseases and these kind of things, and what the food you are taking is right or not, and what are the things you have to change. All these things can be analyzed by using the artificial intelligence, and it can be given. So that, but in a way we are trying to make is a medical horoscope kind of things, what is going to happen. And if you have this healthy food style and these kind of things, so maybe we can say that, okay, within 20 years you will have some heart disease or something if you are going with that. So then we can change some data, and then we can say that, okay, these things we are changing, and then we can say that, okay, by changing these kind of things in your habit, so you can increase 10 more years in your life. So that we can use this human on a chip as a replica of yours. We can do all the experiments, because nowadays doctors will give some drug and they are also giving whether it is working or not. That is when the doctor saying please wait for 24 hours or 48 hours. They don't know whether it will act or not. So but the same thing can be done on the human on a chip, and we can give different kind of drug inside the body, and we can find out which is highly effective and can be utilized on that body. So that kind of things can be done in very soon, and very good health related things can be achieved by using the artificial intelligence. That is our next aim. We have developed a very good group for that kind of things, and we are working on that. So hope we will be able to achieve this one in soon, and this nanotechnology by coupling artificial intelligence and bio nanoscience and everything together, and the theranostics also will give a very good result for the better human being, for a better life. This is what I think I would like to mention about the theranostics. I just briefly mentioned what are the things which we are mentioning, and this is my group, research group which we are working. And I would thank to all my collaborators and group members. And once again, I'm thankful to all of you hearing me. And I hope I could give some glimpses of our work into our bio-nano research field, and hope you liked it. And once again, thank you. Thank you very much for your patience listening. Thank you.
Thank you, sir, for the informative talk. We have a few questions in the chat box. Let me read the questions. We have a question from...
Just a moment, let me come. Yeah, okay. Yeah, thank you. Yeah, yes, please.
We have a question from Savita Matthew.
Yeah.
She initially appreciated your presentation. Then she have a question in an area, something different from the topic.
Yeah.
Just what are the current research concerning nano composites and energy systems in your lab and in Japan?
Yeah, actually, I have not shown some of the things which we are also working on, develop the solar cells kind of things by using quantum dots to capture all the is visible to NIR region, so that we can increase the intake to increase the output. That kind of things which we are conducting, and in related to energy related work which we are conducting.
Okay, sir. Then we have 5 questions from James Raju, sir. But the thing is that sir left us. He had some other engagement. Can
Okay.
question, sir?
Yeah.
The first question is about comment on microwave diathermy using lossy nanoparticles. There is a target cells by functionalizing them or by using a directing external magnetic field.
No, I couldn't clear. That's not clear.
The question is about microwave diathermy using lossy nanoparticles. Whether there is a target cells by
we were always using the functionalization. We are using the functionalization. Yes. We are using the functionalization. So, no, because otherwise, it is very difficult to target it. Otherwise, it will be always a passive targeting. We are interested to use only the active targeting. So after getting the active targeting, even magnetic nanoparticle, after delivering it, we use the external magnetic field to increase the heat so that it can be killed.
Okay, sir.
Yeah.
The second question is about how you direct the near IR laser to target the region without destroying cells en route.
No, NIR laser, it will not create any problem to our cells. Okay. That is the beauty of this one. That's a biological window is there, so it can go without damaging any of our cells. Even if you are putting that one on the surface, it will not create any problem. So that is why even we are trying to use the second NIR window. That's I have mentioned 1000 to 1200. It will not damage. But one main problem is that it may not go deep into that. So there is a limit, maybe some millimeter or some centimeter or something like that. So in that kind of things, you have to use a fiber photodynamic, fiber thing. So after reaching there, then we can send the fiber to kill that. Through that, we can send the laser to that targeting place. We can kill that.
Okay. The third question is about how to take out the injected nanoparticles out of the body.
Yeah. That is what I have told. After these things will be gone inside and it will be killed. So then these things will become a waste kind of things. So it will be naturally gone through our normal kind of things, flushing out our body, as well as if some kind of nanoparticle, just gold or something is there, and non-digestive kind of things, it will go through our lymphatic system, the lymphatic drainage. So normally we found within 24 to 48 hours, almost everything will be taken out from our body. It will be cleared from our body.
The fourth question, sir, is about you talked about the fasting that will cure the cancer. So asking, is there any evidence that occasional fasting led to reduce cancer incidence?
Yeah. That is why nowadays there is a craze started is intermittent fasting. So normally if this autophagosome to set in, so what we have to do, minimum we found 16 hours should be there. Starvation should be there. So by the time of starvation, by 14 to 16 hours, the cells, the normal cells, healthy cells will be there. The other cells, will start killing by itself. The mitochondria, as I mentioned, autophagosome and these kind of things. So from 14 hours, maybe we can say 15 hours to 18 hours, this will set in our body. By doing that, these cancer cells will be killed. So, and you cannot say that that will be fully cleared, but almost if you are continuously doing these kind of things every 2 weeks or something, it will be really good to remove most of these kind of unwanted cells from our body. And then what you have to do, you have to control your weight. That's very important. So how this normally the cells, if more and more cells are there, our cancer things are saying that your chance of getting more cancer. This is there. So what we have to do, because cancer is happening and coming to the cells, so you have to reduce the cells. That's very important. So normally, if you can reduce your body weight, it will be controlled. Along with that, if you go with this kind of intermittent fasting and that kind of things, again it will be killed. So it is very good as a treatment, not as a treatment, it's a control for your health. It will be very good.
Thank you, sir. We have almost covered the question that posted in the chat box.
Yeah.
I have a request to the participants. If any of the participants would like to ask question, now they can ask the question.
Yeah.
By unmuting their video. Hope none of the,
even if it is not now, even if they wanted to get some good answers, then they can send it later also, then I can answer to that one also. It's also possible, no problem.
Thank you, sir. Now we are going to the concluding part of our program. I invite Sneha, second MSc applied student, to propose a vote of thanks.
Good morning, everyone. As we all know, nanoscience and nanotechnology are the study and application on extremely small things and can be used across all science fields. First of all, I would like to express our sincere gratitude to our chief guest, Dr. D. Sakthi Kumar sir. The webinar was very informative, and the information that sir provided to this webinar was most helpful. And I would like to express our thanks to the principal of our college, Dr. Vagi C. Joshua sir, for his leading supervision and guidance. And I take this opportunity to extend our sincere thanks to the guest invites, Santosh Potare sir, Rajagopal sir, Matthew sir, Rajkumari Isaac ma'am, Sridevi ma'am, Casey James Raju sir, Harias Nair sir, Rajan K. Jones sir, Shibu sir for their cooperation and support. I would also thank our beloved HOD, Dr. Reenu Jacob ma'am, for her guidance and support. I'm happy to express our sincere gratitude to my teachers and staff members. And last but not least, I'm happy to express the vote of thanks to all participants and students. And we are also eagerly waiting for the next webinar sessions. Thank you.
Thank you. And thank you for inviting me once again. Okay.
The feedback form also shared in the chat box. I request all the participants to fill the feedback form. Those who fill the feedback form can leave the meeting.
Okay, thank you. Thank you.
Thank you.
Thank you. Rajan sir. Thank you. Thank you very much. And hope we will meet during my next visit.
Thank you, sir. Thank you.
Thank you. Thank you.
Sir.
Thank you. Rajan sir.
Sir.
So കാണാം. Next visit. Corona ആയതുകൊണ്ട് വരാൻ പറ്റുന്നില്ല. അല്ലെങ്കിൽ ഈ സമയത്ത് നാട്ടിൽ കാണണ്ടായിരുന്നു.
Thank you, sir. Thank you.
Okay. Thank you. Thank you. Bye. Bye. Bye.